Hi everyone, welcome back to my YouTube channel. In today's video, I'm going to be giving you some very helpful tips for the PLAB 2 exam. If you're preparing for these exams, you know that there are so many resources out there for you to use. You might be a little bit confused, but apart from the resources that you have, apart from the cases that you have to prepare for, there are also some other tips that will actually help you to improve your score, to do better on the exam day, to pass, and that is what I want to give in today's video. I know these tips will be very helpful to you, so please give this video a thumbs up and subscribe to my YouTube channel so you can get more videos from me about the whole PLAB journey. I have been documenting my own journey, writing the PLAB 1 and the PLAB 2 exams and getting my license as well. So I'm making these videos because I know that they will be very helpful to you. Okay, so in this video you will get some mistakes, some tips, some extra things that can help you improve your score, improve your confidence, and just to get a better outcome in the PLAB 2 exam. So let us get into the video. The first tip I have for you is for you to master your PLAB 1. Yes, at this point I really hope that when you're studying for your PLAB 1, you studied for it seriously, that you understood it, you took your time to ensure that you read your PLAB 1 information very well. And this is important because PLAB 2 is just all about defending the knowledge you learned in PLAB 1. Yes, so this is patient scenarios, talking to patients, counseling them, just applying the knowledge that you learned in your PLAB 1. Studying for PLAB 1 and reading those materials very well, it's really going to help you in the PLAB 2 exams. And that was the one thing I was very grateful for when I was preparing for my PLAB 2 exam. The fact that I studied for my PLAB 1 and I still had a lot of knowledge from my PLAB 1. So when I saw certain scenarios or when I was practicing, I saw cases of patients with different conditions, I already knew the management from studying for my PLAB 1. I already knew some treatments, some drugs, some drug reactions, all of these things because of studying for PLAB 1 and how I took my time to study for PLAB 1. So this is so key. If unfortunately you did not study for your PLAB 1 very well, then you have to go back and revise some of the things that are important, some of the high yield topics in the PLAB 1 and also in the PLAB 2 to help you understand, know the management, treatment, and certain important things for a lot of these high yield cases that you would see in the exam. The second tip I have for you is don't spend too much time after your PLAB 1 to start your PLAB 2 preparation. And this is because a lot of the information that you read in the PLAB 1, you are going to apply it in the PLAB 2. So the earlier you start your preparation for PLAB 2 exam, the easier it will be for you to just transfer the knowledge that you have learned in the PLAB 1 into the PLAB 2. If the gap in between your PLAB 1 and PLAB 2 exam is so long, you might have to struggle with remembering some of these things and you might have to go read some of these things again, but try and ensure that the gap is not so much. You can start to prepare for your PLAB 2 exam even before your PLAB 1 result is out. You can go through some of the cases, read some of the conditions and see how the knowledge you've picked up in a PLAB 1 is going to actually apply into the PLAB 2 exam, and it's really going to help you. So don't let the gap be too much. Depending on the foundation that you had in PLAB 1, I would say if you can, don't exceed 6 months preparing for the PLAB 2 exam till when you write it. I know it's not everyone that can write it within that period, but if you can, don't exceed 6 months to prepare for that exam so that you will still have your PLAB 1 knowledge and apply it in that exam. Because it's not everything that you study for in the PLAB 2 exam that will come out. You might get there and you see something a case that you did not prepare for when you're studying for PLAB 2, but because you already know that case from maybe your PLAB 1 or your own personal knowledge from maybe working in the hospital, you can apply that on the exam day. So it is very, very important. The third tip I have for you is to have one main study material. If you were able to combine a lot of materials in PLAB 1 exam, I can assure you that you should not do that in PLAB 2 exam. I am in some PLAB 2 groups, and I can tell you that so many people struggle to pass PLAB 2 exam, and one of the reasons is that they are combining so many materials. They are using notes from so many different academies, and these academies, their scripts for the exam is different. So one person will tell you manage it this way, use this drug, another one will tell you use this way, and it is all just mixed up. You go to the exam hall, you're talking to your patient, you get so confused, you're using words from one, words from another, and it can be so confusing. And so many people have complained about it in groups, and this is an advice that would really help you. Just use one main study material and another supplementary material. In my video on how I prepared for my PLAB 2 exam, what I used, and how I was able to get the score that I got, that video is on my channel. I mentioned the material I used and the supplementary material I used as well. So you can go watch that video to know what study material I actually used to prepare for my own PLAB 2 exam. But just try and keep it minimum. It will really help you. It would really help you. The fourth tip I have for you is to speak calmly. It doesn't matter if you're confused. It doesn't matter if you don't know what is happening, or if you have too much knowledge, or you realize that, oh, you know this case is something that you can say it even when you are sleeping. You can talk to this, you know everything about this case even when you are sleeping, and you just go in there and you are talking to the patient so arrogantly and without manners or not being polite. Don't do that. Do not do that. Maybe where you work, in whatever country that you work in, you can talk to your patients anyhow and they just accept it. But it is unacceptable. You must learn how to talk to your patients calmly. You must speak with a leveled voice. Emotions should be seen and felt when you are talking to your patients. A patient cannot be telling you that, oh, my father died from prostate cancer and we are burying him next week, and your response will be, oh, that's okay. But you see, this is a reason why you should not be doing this. There's no empathy in what you just said. Your tone is like, it just feels completely wrong. Don't do that. Try and speak as calm as possible. Learn how to talk. If you know that you have this problem, you have difficulties communicating with patients, where you work, people are always telling you of how rude and arrogant you are, or your colleagues don't like you because of how you talk, and you're preparing for this exam. If you do not learn how to talk, you will not pass this exam. You have to learn how to talk to your patients and practice it for the sake of this exam. Okay? The fifth tip is that you should be a doctor. Always remember that you're already a doctor. You don't have to memorize all these scripts, all these cases, how to collect the history, the diagnosis. You don't have to memorize it. You are already a doctor. You know how some of these things are managed. You know how they are treated. Just go there and be a doctor. Because you might enter into one of the stations and realize that you actually don't know this case. You are not too sure. At that moment, the last thing you need is to be following a script. You need to just calm down, talk to this patient like a regular doctor, like you are seeing your own patient in the hospital. Oh, how are you doing today? Oh, I see this is your complaint. When did it start? Has it gotten worse? Like, just communicate with your patient normally and just let go of your script. Regardless of however your exam is, once you enter into a station, remember that you are not just entering there as a student or someone going for an exam. You are actually a doctor. So be a doctor, especially when you're so confused. Just do that. The sixth tip I have for you is practice. Practice. You must practice for this exam. For me, I'll say of all the exams I've written, PLAB 2 exam was the most interesting and fun exam for me to prepare for, honestly. And I could practice for PLAB 2 exam anywhere, anytime. You wake me up from sleep, when I'm eating, at any point in time, I'm able to practice for that exam. And that's how it should be for you. Always practice. There are different parts of the exam, different aspects of the exam. keep on practicing. Keep on practicing for the exam. You can never be too prepared for PLAB 2 exam. That I can assure you. You can never be too prepared. So practice with people, practice alone, read notes, read different parts of the exam, understand, work on yourself, work on your interpersonal skills, work on how you manage the patient, work on your history taking. All these things, just improve on them and continue to practice. And I can assure you that the more you practice, the better you become. If you're not speaking properly before, you notice that how you're speaking will get better. If you're speaking without any empathy, you notice that with time and with some corrections, you will continue to get better, and you will start to remember some of the things that you've read before. So just continue to practice, and this would really help you. Seventh tip is that you learn the structure of the exam, and not just the structure of the exam, but the examiner structure as well. As you know, there are different ways that you can be tested in the PLAB 2 exam. It can be maybe counseling, it can be breaking bad news, it might be a seaman station where you have to handle an emergency situation, it can be making diagnosis, treating. There are so many parts of the exam. So it's very important that you know all the structures, every way that you can be tested, and practice all of them. When you know the structure, it's also important to know how that exam is going to be marked. You need to know the parts, what the examiners are looking for. You need to know how they are testing you and how you will be scored, so that you also understand and know what the examiners are looking for, and you can also apply it to your own exam as well, to your own practice, so that you can fulfill your criteria and also fulfill the examiner's criteria as well. The eighth tip is don't study alone. Not that it's impossible to study alone, but I would advise you, don't study alone. There are so many PLAB 2 groups out there. There are so many people that are practicing for the exams that, I know there's one group I was in. Every day by 5 a.m. they are having practice. From 5 a.m. to 7 a.m. different people are going to present. There are so many ways, but don't study for this exam alone. You can either decide to join groups or have a study partner. I know that although there are so many groups out there, some of these groups can be very toxic. You're in a group, people are practicing, and you only have 2 hours, yet you find people, they just stay in the group and they are just arguing about, oh, this is how it should be done, oh, this is how it should be done, arguing and wasting a lot of time. That can happen in some of these groups. Don't even go there. It is not important. Don't even be in groups like that where people just spend time arguing about small things. Oh, should I inform my senior? Oh, should we admit this patient? Oh, should we give leaflet to this patient? All those things are very unnecessary. So whatever group you're in, you need to ensure that the criticism that is being given is their constructive criticism. Because some of these groups, you will go there, you practice, and then somebody that is listening to you practice will now come and start shaming you or making you feel bad. Or why are you talking like that? Is that how you're going to talk in the exam? Don't be in any group that anybody will talk to you in a way that will make you lose your confidence. Don't do that. There are groups that you're going to find people that will be very helpful to you. So don't be in any group that will waste your time, or people are always demeaning each other or laughing at each other because of how they are presenting. Take yourself out of it. Also, if you can get one person that you can study and practice with, that is so good. If you're someone that doesn't want to be presenting in big groups, just have one person. You can meet this person in any of these groups and just ask if both of you can practice together, or if you already have someone preparing for the exam with you as well, practice just with that person. But don't do it alone, because you need someone to criticize you. You can be doing it on your own and you think, oh, you are doing so well, until someone else hears your presentation and then they realize that as much as you think you know it, you may not pass that station because of how you are presenting. And that's why I just recommend, just have a study partner, and yeah, it will go a long way for you. The ninth tip I have for you is build your confidence. And you can do this in so many ways. It can be through self-affirmations. Continue to tell yourself that you are good, that you will speak on that exam day, you will not have any trouble communicating. Like, also practice practice speaking to people, speaking in a calm way. Just continue to practice and continue to build your confidence. And that's why I said it's important that you are not in any group that anybody will demean you or make you feel bad for how you are presenting. There are different ways that you can be criticized, that your presentation can be criticized without demeaning you, but correcting you in a very helpful way. So on your own, you have to be able to boost your confidence. Learn how to talk, practice with other people, tell yourself that you can do it, and actually believe in yourself, because a lot of this exam is just confidence. Because you can go into a station, and if you're so afraid and so timid, you can even see a scenario that you know how to manage, but because you are not confident in yourself, you might just mismanage that situation. So ensure that you are confident in yourself. So even if you cannot manage a scenario, a case that you see in a station, you can still confidently handle this patient like a doctor would, and you will still seem very confident to the patient and to the examiner. So anyway, you can just build your confidence and continue to work on it, because it will really help you on that exam day. My 10th and final tip, and this is what you should do when you are standing outside your station. Before you enter into the station, you stand outside the door and you are reading your questions. Please read your question very well. Calm down. Don't just read your question once. Read it once, read it again, and ask yourself, what do they want me to do in this station? Am I supposed to go there and examine? Am I supposed to talk? Am I supposed to counsel? Just read it. Get an idea about what you are supposed to do just by reading the information, the question that is outside there. You remember that if you forget, the question is also inside the station as well. So you can always put your head down, tell the patient, give me a moment, let me go through my question. You go through it again right there, but ensure that you are reading your question very well and don't miss out on anything that is important. And also, while you are standing outside there, sanitize your hands. That sanitizer that is outside every station is very, very important. It is there for a reason. Don't go into any station without sanitizing your hands. That is a special tip from me to you. Alright, so these are 10 tips I have given you in this video that would really, really help you to boost your PLAB 2 score. And if you have any questions for me, please leave them in the comments section. Give my video a thumbs up and subscribe to my channel, because I have a lot of videos on my channel regarding the whole PLAB exams, and I know that they'll be really beneficial to you. Alright, thank you for watching, and I'll see you in my next video. Bye bye.